The measurements are performed in the right liver lobe by placing the probe in between the ribs in the 7th to 9th intercostal space, perpendicular on the liver surface. According to the different techniques, you have to apply sufficient pressure on to make a good contact with the tissue. Of course, we have to put gel between the probe and the skin for the ultrasound to propagate properly. Now I am looking for a good position to acquire measurements. Here I show to you that the acquire button is on top of the scroll, and the box must be placed at least at 2 centimeters away from the liver capsule, and it must avoid large vessels and biliary ducts. Before performing the measurement, the patient is asked to stop breathing, avoiding deep inspiration. Another trick is to stabilize the hand and the probe while performing the measurement. Here I took the first measurement. I pressed acquire. Now I have a value on the screen. The value is both measured in meters per second and in kilopascals. Then I pressed print store, and the value is saved in the left of the image. And there we can see that the machine automatically calculates the median, mean, and the rest of the values, IQR and IQR per median. Also, we can zoom the image to see better the liver and the box, where we can put the box to avoid vessels and biliary ducts. And of course, then we can took 10 measurements. This is the recommendation for point shear wave elastography. Of course, there are studies that shows that 5 measurements are as well as 10 measurements, but for this machine we took 10 measurements. We take 10 measurements every time. Okay, a little recap. When I want to take a measurement, I press acquire button, which is on top of the scroll. Then I press the button print store, which is on the right side of the scroll. And then I press unfreeze to take another measurement. As you can see, here the values are for a normal liver. I told you that uh, in the beginning we will start with the normal subject, and then we'll pass on to a cirrhotic patient to see the difference on the values and the difference of the liver structure. Okay, we take another 2 measurement. Again, acquire button, then print store, and then unfreeze. Good, now we took 10 measurements. Here in the left side we can see the results. There we have IQR per median, which should be under 0.3. And we have the other results. Especially we are interested in median because that is the value that matters. Then I press the report button, where uh, the machine shows me again all the results, and here if I want I can delete a value or more to make that IQR per median be less than 0.3. Of course, if I want to delete some measurements, then I can took again another ones.